So University College London is a very established, world-leading research-intensive university, and it's London's top fully comprehensive university. So we not only have STEM subjects, we also have a wide range of other disciplines as well. And the Global Business School for Health is the first business school in the world totally dedicated to health and healthcare management and leadership. So we're at the cutting edge of reimagining what it is to manage global healthcare systems. We're looking at global health and healthcare from business perspectives, and we're really challenging the status quo. The pandemic has disrupted many systems in the world and the way we do business and healthcare, and we're looking forward, extrapolating lessons from the crisis. So University College London is 8th in the world. It's exceptionally well known for population and public health science and research, and the Faculty of Population Health Sciences, where GBSH is based, is ranked 4th in the world. So let's move forward. So that's who we are. So the important question today is why study with us at UCL for the MBA Health, and why not do one of the myriads of general MBAs out there in the world? So Kim Clark, who was the dean at Harvard Business School, made this comment, which I think is quite relevant to helping you decide. So he said that medicine and business have long been intertwined, so they work closely together. But today, with the extraordinary promise of emerging medical technologies, sweeping change in delivery of healthcare, and the push to control the costs of medications, the need for leaders firmly grounded in both fields has never been greater. So it's a growing, dynamic sector, and it's a complicated, complex sector. So doing a general MBA is very helpful for you to gain insights into the specific disciplines and functions of management and leadership. But because it's a specialized sector, completing an MBA in health enables us to build in right from the outset, throughout our case studies, throughout our teaching delivery team, and in our research, all those different MBA functions across various disciplines, firmly embedded with this very complicated and dynamic and complex sector of health care and the business of healthcare and healthcare management. So we look very closely at issues of leadership, what's going on in the C-suite and at various management levels in healthcare and hospitals. And a 2019 WHO report entitled Delivered by Women, Led by Men, shows that there's a real shortage of women at the top. So globally, only 5% of healthcare leaders are women, and even in countries like the US, the UK, only 20% of leaders are women. So the real challenge is we're not getting diversity at the top levels. We're looking at, for example, general practitioner, primary care practices are becoming more business-like. And for clinicians and non-clinicians' career goals, an MBA Health will massively accelerate your networks and your careers in the healthcare sector. So not only will an MBA leverage your career prospects, but an MBA Health in the healthcare sector will give you that added advantage. So certainly many people who do MBAs are not entirely satisfied with their current state. So they do an MBA because they want to get some headspace to transition and transform their careers for new opportunities, to develop not only their careers, but themselves. So their self-confidence, their presentation skills, their analytical skills, their critical thinking skills at a new level, so that it's evidence-based decision-making in the workplace. So we are looking at how you shift from being very effective, perhaps as an undergraduate in your current job, based on your individual contribution, to how you actually catalyze others to shift organizations forward. And how perhaps you build a portfolio career. So you may be a very specialized in something, but also you want kind of generalist understanding. So you're a kind of T-shaped professional, so that you can pivot in different directions. So maybe in policy, maybe your background is not in healthcare, but you will move into healthcare so that you can perhaps become an entrepreneur. You can work in different parts of the healthcare industry, consulting, legislation, NGOs like the World Health Organization, in ways that would have taken you much longer if you hadn't come to us for the MBA Health. So most MBA students obviously are looking for content and knowledge, but also contacts are very important. So making connections, making networks, and we have an extensive network of residents in health who are currently chief executives or former chief executives or management consultants and practitioners who can really move your career forward much faster than if you were left to your own devices or if you were left to a general MBA. So what we're offering at UCL is a kind of boot camp. So we're offering an immersive, intensive, and hopefully a really enjoyable, transformative 1 year full-time or part-time over 2 years, focusing entirely on healthcare management and leadership, and importantly, developing your soft skills, as well as your analytical, your critical thinking, and the kind of hard skills of that you may have got purely from looking at content, and really enhancing your credibility, your legitimacy. So you can walk into a room of policymakers, NGOs, big pharma, civil servants, investment bankers, venture capitalists, entrepreneurs, and you can speak the language of these different parts of the healthcare sector. So many of the applicants are early career. They're taking a year out, or they may be slightly kind of early mid-career to reboot their career prospects. And they're coming to UCL because I guess we're in a world-class city. We're in one of the most exciting, dynamic cities on the planet. And UCL is a highly regarded brand and a very reputable university to be associated with as a graduate. So it's first in the UK for research, and it is truly underpinned by a very strong focus on health, medical and life sciences. And it's not a specialist university that only teaches social science or only teaches science, but it mixes the two. So interdisciplinarity, addressing the UN Sustainable Development Goals, not only of health and well-being, but also of inequalities, addressing inequalities, communities, building communities in UCL East, where the new campus is based, is a very important part of our ethos in making a difference. So what will make you stand out if you join us and graduate with us? So as I've said, healthcare is not just an add-on. It's not just an MBA with a little bit of health stuck on the end. Healthcare runs through and through the DNA of UCL and the DNA of this MBA. So it's not an afterthought. All our academics, all our practitioners have worked, taught, researched on health and healthcare, and they're at the intersection of business and health. So clearly with the COVID pandemic, we realized how important this sector is. So from day one, the induction, pre-arrival, you will have course materials, case studies, quizzes, activities, materials based in the health and healthcare sector. We have a whole group of these executives in residence whom you will meet at various events. We have an event in the very first induction week. Then we have a residential school weekend too, where you'll get to know each other and us. And from the point that we talk to you at the interview about your personal statement, we will be focusing on your career aspirations and your career journey. So we have a recruitment agency and careers coaches that you will be working with from the very beginning to graduation and beyond. Hopefully you will keep in touch with us to help you evaluate your career goals and to hone your goals and the skills appropriately. And we look forward to you coming back to share your experiences and your case studies with us. So we aim for this to be a kind of lifelong relationship of connections and knowledge exchange. So the typical career background and profile of MBA students who are applying for the full-time MBA, they're typically in their late 20s, in their 30s. They have a good academic or clinical background with work experience, which may have been gained full-time or voluntarily during their studies. They're ambitious to make a difference in the world. They want to create societal impact. So they have a mindset to help patients' well-being and health and to help people's lives. And they may have come or they may be looking to move into sectors such as pharmaceutical industry, biotech, consulting, and to move their careers to the next stage, and particularly to gain an understanding of global healthcare systems and to link with peers. So typically MBAs have traditionally looked at consulting opportunities. So there will be skills we will be developing in not just clinical consulting, but management consulting in the healthcare sector. So we have colleagues from KPMG, for example. So working with these consulting firms, PwC, Deloitte, EY, McKinsey, BCG is very important for us. We also work with big pharma, various other types. We have an advisory board for the MBA from different sectors and different parts of the world, including the World Health Organization. We have members of the course team who have also worked in these industries. We also have entrepreneurs who founded their own businesses in various medtech companies. And we have medical directors, dentists, nurses, pharmacists who've worked in the public, private, and social enterprise sectors at different levels. So we'll expose you and challenge you beyond your comfort zone to work with your goals and also to gain exposure in different kinds of organizations like the NHS, Bupa, GSK, Merck, Roche. We have a scholarship too. So next, I'd like to move on to what the program actually looks like. So we already have a calendar with the topics and the dates and who will be delivering them. So basically, the design was developed in close liaison with people already in the industry and who are interested in reimagining that industry. So as I've said, it's interdisciplinary, cross-sector, and cross-national, different parts of the world. So we're looking to develop exceptional leaders of the future. So all the way through the MBA, it's about making the link between theory and practice. So what are these nice, neat theoretical frameworks telling us, and how do they work in practice? So you as a leader or manager are the translator, the mediator between theory and practice. So we'll be developing your skills in research and project management. And as I said earlier, GDP in many countries now is 10% spent on healthcare and growing. So how can you make a difference in this rapidly growing and dynamic sector? Importantly, to improve patient outcomes in a world where we have aging populations, a rise in non-communicable diseases, and obviously multiple crises, mental health crises, financial crises, public health crises. So we believe that you will be highly sought after when you graduate from the program. So in terms of practicalities, the induction starts on Monday, the 26th of September, and you have a full in-person induction week. Before that, there will also be materials posted, primer materials for you to get to grips and start to understand your needs and the course. And it's part-time for 24 months, full-time 12 months. Most people are doing the full-time at the moment. And we have a brand new state-of-the-art campus opening in UCL East in London. And also, obviously, the main campus in Bloomsbury in Russell Square. And the tuition fee is £45,000, but there are plenty of scholarships available, GBSH scholarships and UCL scholarships, as well as external scholarships. So as I mentioned, we kick off with this induction. You have online materials. You have an in-person week as well as a weekend. So we get to know you, build your teams to help you with your journey. And that will include in the countryside, stay in a hotel for a couple of nights, a whole range of personality, team building exercises. And then the structure itself basically comprises four-week taught kind of sprint modules plus 2 projects. So you kick off with strategy, people, and marketing. So 1 week for each of those, and then you have a wrap-up week. Then you do your assessment over 2 weeks and preparation for the next module, and then you have another 4 weeks. So 1 week on funding, and 1 week on finance, 1 week on regulation, and then a wrap-up week where we bring things together, and then you have another break. And then we actually go away in January for 2 weeks. I'll come on to that in a minute. We go overseas, and then you come back to 2 more of these 4-week modules. So we have 4 weeks on data-driven management, 3 separate modules in that block and a wrap-up. And then you'll have 3 options and another wrap-up week in the 4th block, which is called Contemporary Topics in Health and Healthcare. So the format for all those blocks will be very similar. Lots of case studies, you'll have site visits, guest speakers, lots of interactive sessions. And we run the in-person sections in the afternoons. So 1 to 6 o'clock, Monday, Tuesday, Thursday, Friday for the blocks. And then Wednesday afternoons, we do general 1 to 6 p.m. classes linked to general things like ethics, research methods, soft skills, general skills, to help you with the 2 projects. So the first of those projects is a Global Health Challenge project. So this is a team project. You do a team report and a presentation. So we have connections, quite strong connections in Riyadh, in Lagos, and my deputy, Pretty John, is working on deciding the locations in India. So in your small groups, you'll be going to one of those 3 countries for a 2-week immersive experience where you collect data. So we'll meet with colleagues, we'll visit different healthcare institutions, we'll have round tables, and we'll also have opportunities for you to do live research. So obviously we need in the first term to prepare for that January visit. And you'll be accompanied by a supervisor who will work with you one-to-one on your project and help you with the group dynamics. So the whole point of the Global Health Challenge is to gain in-depth knowledge of one particular area of health and healthcare, global healthcare systems in a low and middle income country, and to apply your business and leadership skills throughout the whole year. So you hand that project in at the very end, you work on it throughout the year. And then the final assessment is your individual health consultant project. So this is when typically you will work independently, or there may be several of you working on the same project, but you submit it individually. So for example, Kiajan has a project for us in Oman on TB infection that they would like somebody from the cohort or several people to work on. So it's very important that you link this to your career goals. You talk to your careers coach and executives and residents about this. So it really will help you on your CV when you graduate to shift into the kind of work you want to do. So you're actually going to have a brief. You're going to work for a health client of your choice, that from a package of options we give you, or you can decide where you want to work and develop your own links with our support. So we'll make sure this is a good fit for you, not only to develop your consulting skills, but to get you hired. So clearly it needs to be a knowledgeable, a well-informed project based on the literature and global healthcare thought leadership. But you also need to develop skills in working with the brief, coming up with solutions for your client, and meeting their expectations for their particular metrics as well. So if you decide to apply, these are the kind of criteria we're looking at for individuals when we're recruiting. So we want people who are ambitious. They do want to be leaders, to take on leadership positions and to make a difference in the sector. They may come from a whole diversity of backgrounds. So we have dentists, psychiatrists, general practitioners. We have a range of clinical nursing, pharmacy, architect even, backgrounds, professional backgrounds. And we also have people who are very generalist as well, marketing. We have someone who has a legal background, someone who did social science in Harvard, and who's now working at UCL on a research project. So we're looking at people already in the healthcare sector who want to gain more about leadership and management. We're also looking at people in leadership and management roles who want to know more about the healthcare sector. And we have a very diverse, geographically diverse group of people who've already offered places to. So the main thing is that we want you to be ambitious, to work in healthcare. And I guess these are the points. Repeat that really. So you may be pivoting, or you may be enriching your experience already of healthcare, and you want to be brave and courageous and work at a different level. So what do we need from you to convince us to take you onto our program? So the academic requirements are that we need you to be ideally a graduate, equivalent in attainment to a 2-1 degree of an upper second class degree in the UK, so that's a minimum. If you aren't a graduate with a relevant degree classification, we also want extensive work experience. On a case-by-case basis, we'll determine that. In terms of language, we want IELTS at level 6.5 or above, and no area within the IELTS of less than 6. And you can do pre-course IELTS language courses at UCL and not have to do the IELTS if you pass that at the equivalent level here. Ideally, we like you to have 2 or 3 years minimum work experience, but that can be varied. It doesn't have to be full-time or paid. Ideally, we like a GMAT score of around 600 overall, a balanced GMAT score, but you can actually ask for a waiver in certain circumstances for that. And we interview everybody. So Nora Colton, who's the director of the Global Business School for Health, and we have 20 minutes, 30 minutes interview with everyone online to try and get an understanding of your career journey and whether the MBA Health and UCL would be a good fit. And finally, we want a personal statement from you, which helps you figure out why you are applying and is part of that career journey, and 2 references. So one can be academic, one can be more general. So the GMAT exams can be done online. It's good to practice them. Excuse me, find out areas for development. You don't have to go to a center in person. And these really assess your analytical writing, your verbal reasoning, your quantitative skills, integrated reasoning. So all the kinds of skills that we are developing anyhow on the MBA. And you can try multiple times, and your highest score will be recorded. We don't want the interview to be an ordeal. We want the interview to be an interesting conversation so that we can get to know you and you can get to know us. So typically, these are the questions we'll be asking you at the interview. So a little bit about your background, your motivations, your journey, why an MBA Health now in your career, what you will bring to the cohort, what we will remember you for, and what makes you stand out from the other candidates, what you're expecting from us, so we can customize the program in many ways to help you, some understanding of your strengths and your areas for development, and where you would like to be by, say, 2007, 2008. So if you are going to be interviewed, do remind yourself of those questions. We have, as I said earlier, specific GBSH scholarships. So Roche has very generously donated a full scholarship for a UK student eligibility for people from low income or BAME backgrounds who identify as female. So this is a full scholarship plus living expenses. We also have a Future Impact Leader Scholarship, which is a third off the tuition fees for exceptional candidates who are looking to make a real difference in the healthcare field. We also have scholarships for women, £5,000. And we have an East London Healthcare Leader Scholarship, also 5,000. So you can apply for more than one of these scholarships. In addition to UCL scholarships, so there's a UCL scholarship finder page. There are obviously scholarships in different parts of the world. There's a US federal funding. There are postgraduate loans, Chevening, Commonwealth, Fulbright, great master's bursaries. So you can look for a package from these various sources. Okay, so just to sum up how we are supporting your careers, we're very mindful that clearly intellectually this is important to develop you personally, but also it's very important to ensure that our alumni are successful and will be out there in the world for us to work with beyond the year or 2 years they're with us. So we have fully online primer courses that can be tailored. So those include, for example, fundamentals of accounting, finance, and economics, looking at the UN's Sustainable Development Goals, developing your study skills, time and energy management. So you decide what is most relevant to you to get up to scratch. And then the induction will be focused particularly on you as a person, organizational behavior, working across teams and within teams to help you with that overseas project and the group work and teamwork and activities we'll be doing throughout the year. Residential school, hopefully you remember as a kind of transformational experience. We'll be doing some very psychometric assessments, one-to-one career coaching, and this will be continued throughout the year. You also have access to UCL career services and the innovation and enterprise services as well, job boards, job shops, career workshops, and so on. We all know that health and well-being and mental health have been severely tested during the pandemic. So it's very important that you do other things than just study. So that's the great benefit of being in London. There's a lot of free opportunities to go to museums. We're in the Olympic Park, so you can engage in activities there, but there's also the Students' Union, the UCL Students' Union, with many, many clubs and societies, 250 listed here, 70 sports clubs. We're hoping that GBSH students will form their own club that we can encourage people to join. We'll also actively help you with volunteering. So if you want to work to volunteer in a hospital, you can actually work for 20 hours a week also as an overseas student. And there is support for your own health and well-being in terms of if you're transitioning, coming to a different country, doing a different discipline, getting settled in, we'll help you with that accommodation. Students' Union also has support. So I wasn't born in London, I was born in Wales, but I've lived here most of my adult life, and it is an amazing city. I've been to many, many cities around the planet, and London gets better and better, I think. It's a very walkable city, it's a very livable and very inclusive city. So Bloomsbury is the home of UCL, it's the main library, but there are 16 libraries spread over London. As you can see, many tourist attractions. Here's the Thames and the famous bridge. Many, many parks, many sporting, musical events, pubs and clubs. And in the QS rankings, it was ranked the top city for students in the UK. Very easy to get in and out of, the Eurostar, flights, coaches, travel. So if you're new to London or new to the UK, I think this will be one of the best years of your life, not only because of GBSH, UCL, and the MBA Health, but also where we are. So we have a series of webinars and further information about open days like this, scholarship and funding information, details about the Executive MBA, which we're launching in 2023, which will be almost entirely online with 1 week in the UK and 1 week in the US. So feel free to check out our website to find out more about the Global Business School for Health, or do get in touch with me personally or any of my colleagues. We'd be very happy to talk to you individually for an MS Teams call before a formal interview. So that's is all I want to talk about in terms of the relation to the slides today. So feel free to post your questions in the Q&A tab on this Zoom call. You can put your name and we can get in touch with you as a follow-up as well, if you like. And here is my email if you'd like to get in touch with me personally. Okay, so I'll stop the presentation now and I'll hand it over to the Q&A and see what we have in there, some questions. Okay, so one person has asked, do we have to prove English language requirements even if we have studied at a UK university? So my understanding is the answer is yes. So if you are not, which is maybe a bit confusing, if you're not born in the UK or the UK resident or passport holder, you need to, there are requirements that cover all UCL that you have to meet. And another question, can you share this video? Yes, all our videos are available afterwards, so you can see this recording or a previous recording as well. So thank you for that. Okay, so we still have half an hour, actually. We have quite a while here. So I can see we have a few people in the audience, so feel free to post a few more questions. I can see Edward, Myrna, Ollie, Osama, and other people in the audience, so very happy for you to ask any more. Yeah, Ollie, you'd like to speak one-to-one? Yes, that's fine. You can just send me an email, julie.a.davies@ucl.ac.uk, and I can talk to you personally. Be happy to do that. Send me some times that you're free, and I can arrange that. Great, thanks, Ollie. Okay, it's quite a small group today, so do feel free, don't be embarrassed to ask any questions. Myrna, would you like to ask anything or type anything? Osama, Edward. Okay, I think I've answered all your questions. I'll give it a couple more minutes. Myrna, right. Oh, Myrna, we're talking anyway this Friday. That's great. Great. So I look forward to speaking to you. And Osama, Edward, any questions from you you'd like to ask? Okay, thanks, Edward. No questions. Okay, well, it's been very good talking with you or giving you a presentation. I hope you found that useful. If you've got any other comments, questions for this September or for the EMBA, we also have other masters that are mainly online. And we are also launching a doctorate in business administration in health as well during the course of this year. So certainly if I had my time again, I think I would be not doing a general MBA like I did. While I was working in the National Health Service, I would definitely do an MBA in health because we had a webinar last week with the Director of Workforce from the World Health Organization and several other colleagues, and looking at the definition of decent work, which is like good employment and job security. I think we're not going to run out of jobs in the health sector. There's a massive shortage of workers in the health sector. And it's very important that we have good quality leadership and management to ensure that that is decent work, which is what the World Health Organization is putting up a new compact to make sure that healthcare workers are also looked after, as well as obviously looking after everyone else. So I think that's a very important aspect. Okay, so we'll draw it to a close for today. Thank you very much for your attention. I look forward to speaking to at least two of you soon, and feel free to get in touch at any point. We're very happy to talk with you about various options for you to come to London or to stay put and get UCL on your CVs. So thank you very much for now, and have a good rest of the week.